Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, my name is Nur Fatina Nabila binti Ahmad Fuad. For our use case study, our persona is elderly, Malaysian aged 16 and above, living in both urban and rural area. They are the main group affected by Malaysian transition into an aging nation. As the number of senior citizens continue to increase, it is important to understand their needs and challenges. By focusing on this group, we can identify the goals, pain, gain, and solution needed to help Malaysia become more prepared for an aging population by 2013. For our case study, Aging Malaysia, Are We Ready? Our team first identified the desired state for our persona. Using a human-centered design approach, we focus on the most desirable outcomes that would improve the life of elderly Malaysia. Our first goal is to improve healthcare and well-being by ensuring better access to healthcare services, especially for senior living in rural areas. The second goal is to strengthen financial and social support system so that elderly Malaysia can maintain a good quality of life and stay connected to their community. The third goal is to create age-friendly environments and infrastructure that are safe, accessible, and supportive for all the adults. The fourth goal is to prepare for the future through technology, innovation, and sustainable policy that improve elderly care while remaining easy and practical for seniors to use. Together, this goal represents the desired future state where elderly Malaysia can live healthy, independent, and meaningful life. This goal will guide the solution we explore in the next part of our canvas.
Hi, my name is Nadia and my student ID is 2026555041. So I'll be presenting for parts, pains and gains. So elderly Malaysians face several challenges that affect their daily life. First, access to healthcare remains difficult, particularly in rural areas where medical facilities and specialists are limited. Many elderly individuals also experience social isolation due to living alone or being separated from family members. Financial insecurity is another concern because retirement savings may not be enough to cover living and healthcare expenses. In addition, many public facilities and transportation systems are not designed with elderly users in mind. These challenges can lead to poorer health, reduced independence, and a lower quality of life. So next part is gains, what would improve their life. To improve the well-being of elderly Malaysians, several gains can be achieved. This includes easy access to healthcare, more trained caregivers, and elderly-friendly facilities that support independent living. Social programs can also reduce loneliness and improve mental well-being. Technology plays an important role in achieving these gains. For example, telemedicine allows elderly patients to consult doctors remotely, while wearable devices can monitor health conditions in real time. Integrated health records can also improve coordination between healthcare providers. Together, these solutions can also help elderly Malaysians live healthier, safer, and more independent life. In summary, addressing these key pains of healthcare access, social isolation, financial challenges, and accessibility issues can also create meaningful gains that improve the quality of life for Malaysians' aging population.
Hi, my name is Ahmad Zahiruddin, and these are some technology solutions to address the challenges of an aging population in Malaysia. The first one, we have telehealth platform such as Doctor On Call and MOH My Health. This platform need to be expanded, especially in rural areas. With this platform, we can help the elderly to get their consultation from the doctor and also help them to monitor their health without traveling far. Next, we have AI predictive health. This AI can help them in analyze medical data and also can detect early risks like fall, dementia, and also heart disease. The next one is smart home or IoT. The example of this is like fall detection sensors, emergency SOS button, and also voice assistant. With this technology, we can help elderly to stay safe at home and live more independently. Next one is integrated AHR system. So with this integration, we can connect their data and records from MOH, SO, CSO, and also EPF. This also can reduce repetition of the same test and also improve coordination between healthcare providers. Besides technology, community and government support is also important. For example, the government can improve elderly policies, increase welfare support, and also strengthen protection for older people. Next is PAWE centers, which is Pusat Aktiviti Warga Emas, need to be expanded to rural areas. With these centers, they can provide social activities and reduce loneliness among the elderly. Next is caregiver training program. With this, they can produce more skilled caregivers and volunteers. The last one is age-friendly city. Malaysia need to improve their public transport accessibility and also build more elderly-friendly infrastructure such as ramps, elevator, and safe walkways. Most of these solutions is already available in Malaysia, such as Doctor on Call and MOH My Health, and also PAW centers. But for technologies that are not widely available in Malaysia yet, Malaysia can adopt these new technologies in future.
Assalamualaikum, my name is Nashrik and we're moving on to section 6, that is resources. This section addresses what information, data, infrastructure and human capital must be in place before any solution for Malaysia's aging population can realistically be delivered. We have identified 3 categories of resources. The first is data and information. Effective elderly care cannot be designed in the absence of reliable evidence. Malaysia National Health and Mobility Survey provides the foundational data on disease burden among the elderly, covering chronic conditions such as diabetes, hypertension and cognitive decline. Alongside this, the Department of Statistics Malaysia holds census data that maps the distributions of Malaysians aged 60 and above across states and across urban and rural divides. This is particularly important given the infrastructure gaps. For example, Kuala Lumpur and rural states such as Sabah are very substantial. Finally, the longitudinal research produced by my agent at University Putra Malaysia (UPM) gives us the academic depth needed to translate population trends into policy recommendations. The second category is infrastructure and technology. Several existing national platforms can serve as the delivery backbone of our proposed solution rather than develop entirely new systems. The Jendela National Digital Connectivity is already expanding 5G and broadband coverage into rural areas. This connectivity is prerequisite for any telehealth or remote monitoring service to function beyond urban centers. The MySejahtera platform, widely adopted during pandemic, can be extended into manage elderly chronic disease records and appointment system at community level. And the Ministry of Health Assisted Electronic Medical System provides the foundation upon which a unified elderly health dashboard can be built, linking public hospitals, clinics, EPF and SOCSO into single care continuum. The third category is human and financial resources. No amount of technology will substitute for people and funding. The HRDC or Human Resource Development Corporation administers training grants that can directly fund the National Caregiver Certification Program as we are proposing. For states where Islamic financing is culturally appropriate, Kelantan or Terengganu in particular, Waqaf Endowment Fund represents an underutilized but viable model for establishing community aged care facilities without burdening the federal budget. And critically, Malaysia's established gotong-royong community networks embedded in villages, mosques and neighborhood associations represent a human resource of considerable scale. These volunteers, if properly coordinated and supported, extend the reach of formal elder care into rural government services cannot efficiently penetrate. In summary, the resources Malaysia requires are not absent, they already existed. The challenge is one coordination, integration, and political will to deploy them purposely towards the needs of our aging population. Thank you.
My name is Suhairi from Group 6. Now we've seen the product, the resources, and how both fits in. Let me bring this together by covering two things. What our role is in delivering this, which is in Section 7, and the support that we need from relevant agencies to make it work, which is in Section 8. For Section 7, the roles, we see our role operating in three capacities. First, as innovators and solution designers, we would design and prototype a Bahasa Malaysia AI health companion app built specifically for elderly Malaysians with low digital literacy, and we would also develop an age-tag use case framework that adapts across all 14 states, whether urban, semi-urban, or rural. Second, as researchers and advisors, we would conduct user-centered research directly with elderly communities in Sabah, Sarawak, and Felda settlements to surface the needs that are usually overlooked. We then advise KPWKM on evidence-based policy, translating MyAging's research into recommendations they can actually act on. Third, as collaborators and connectors, this is where we bridge the gaps, linking MOH, private hospitals, NGOs, and tech startups to create integrated care pathways with pilot intergenerational living and a silver gig economy, connecting elderly craftspeople such as in batik and woodcraft industries to digital marketplaces, and mobilize university students through MyCore to serve as digital buddies for isolated seniors. So in short, we are not just building a product, we design it, we researched it, and we connect the ecosystem around it. In reality, we cannot do what we intended to do in Section 7 alone, which brings us to Section 8, how all relevant agencies can support us. We've identified 7 key partners. The first one is MOH and KPWKM. They would fund the telehealth infrastructure, issue regulatory approvals for our AI health tools, and gazette a revised national aging policy. MDAC, through Magic, would launch an age-tech startup sandbox to accelerate Malaysian elder care startups. EPF and SOCSO would introduce an elderly-focused medical insurance account and extend Perkesu benefits to informal caregivers who are currently unprotected. Kemas and RTM would run a nationwide #SeniorConnect digital literacy campaign to lower the tech adoption barrier. Local councils would enforce age-friendly building codes and fund PAWE centers in undeserved districts. UPM's MyAging would supply the research evidence to justify budget allocation and monitor outcomes annually. And finally, the seventh one, the private sector, through CSR, would co-fund smart home devices for B40 elderly tied to BSH and SDR programs. To summarize, our role within this solution is to innovate, research, and connect. And with coordinated support across government, academia, and industry, this becomes a sustainable nationwide solution for our aging population. Thank you.